I think the biggest medical legal issues at the moment are probably three things. So the first would be poor documentation in the medical records, or inadequate explanation of what the thinking was behind the decisions to do a particular procedure or treatment for a patient. So that's one area. Another area is lack of good informed consent. That's probably a big major issue as well. And the other area probably is around delays to treatment, which aren't so much a problem for the vascular surgeon, but the vascular surgeon often takes the hit for the delays in referral and treatment in primary care. So the vascular surgeon gets to be the fall guy for the inadequacies of other clinicians. The medical legal issue I focused on this morning was on informed consent, and that is largely has been changed in the UK dramatically by the Montgomery ruling, which was a Supreme Court ruling in 1995, which overturned the previous tests of acceptable behaviour practice, which was called the Bolam test, which was that if your practice was considered reasonable by a responsible body of clinicians, whatever responsible means, then that was okay. So the Supreme Court threw that out for consent. So essentially what that means is that when you're obtaining consent from somebody, you have to explain all the options, including no treatment or other options, and you have to explain it in a way that the patient understands, and you have to explain it in the detail that the patient requires. So that requires quite a detailed conversation with the patient to understand how much they want to know or need to know. So essentially what that's doing is passing the responsibility to the patient away from the doctor. So it's the death of medical paternalism, if you like. Doctors protect themselves from these problems by being very careful about their documentation. So a signed consent form is not consent. It doesn't count in law. You have to demonstrate that you've had a discussion with the patient, that you've given them information about all the treatment options, and if you can't provide a treatment option, you have to consider whether you should send them somewhere else. So just because you haven't got a treatment option in your hospital doesn't mean you still have to discuss it and offer it, and if necessary refer on. We've already had the paclitaxel debate yesterday about the increased risk of mortality from paclitaxel. So a lot of I would recommend to surgeons that and radiologists that if you're going to use drug-eluting balloons and stents, that's probably still okay, but you must tell the patient that there may be an increased risk of mortality. And it's for the patient to decide, not you.